Thank you. Welcome.
Thank you.
We're getting there.
Yeah, gosh, it's been a nightmare. I can hear you, but I cannot see you. I can see myself, though.
Okay, I'm not sure where the issue is, but at least thank you for being able to connect. We can hear you. Hopefully, we'll sort out the video. Um, if I may just ask, I was trying to introduce you briefly without taking too much away from you, and I've confirmed that you wear many hats. You're a physician. You're also a medical oncologist, and in terms of a medical oncologist, you look after people with cancer. Also, as a physician, you can treat most medical problems, excluding women's health, children's health, and mental health. But now that you've come on board, do you just want to tell us a little bit about yourself, who you are, what you do, and what we hope to learn from you today?
Yeah, thank you very much, and thank you everybody for joining. Apologies for the technical hit. Um, my name is Okezie Ofor. In a previous life in Nigeria, I was consultant cardiologist, uh, and I also did a lot of endocrine medicine. So things like um, heart problems in blacks, together with blood pressure and diabetes and stuff. Those were my areas of specialism. And then I came over to England and I decided to retrain. And yes, together with Dr. Saka, I do medical oncology, and I treat people with breast cancer and urological cancers, and also for the moment, some people with pancreatic cancer. Um, it is a lot of hard work, but yes, I'm happy to be here. Thank you.
Thank you. And so, just apart from your medical life, and I see you've got a very, very busy medical life. So, what is it that you enjoy doing? So, outside of medicine, who are you? What are you? And what do you do?
What I enjoy doing most is actually reading, you know, getting some books in politics and economics and religion and just acquiring knowledge. I mean, for me, the best possible way to spend a Saturday afternoon is with a book about Chairman Mao of China and a bottle of Coca-Cola. And you could leave me with it, and I'll be very content. I also love to travel. I just the thought of getting into a train or an aeroplane and going to a different place is very stimulating, and I play with my children. And those three things are the things aside from making money, they're the things I enjoy doing most. Yep.
Okay. So there are a few things you've said there, but you spend all of your life reading. Don't you get tired of reading?
Well, God, who can ever get tired of reading? I'm not sure there's anything more stimulating than being immersed in a book of history, a book discussing Genesis chapter 1. Books are a lifeline. And left to me, I think people may not even need to go to formal schools, but just to learn to study and to read and acquire knowledge. It's it is fascinating.
And I see you mentioned there about making money. So
Mm.
you're also a businessman on the
So,
side.
I'm a proper Igbo man. Yeah. So yeah, I tell you, as far as I'm concerned, going to school itself is not a harbinger of wealth. It is not geared towards making anybody live well or better as far as finances are concerned. Schooling has its advantages, but it's not necessarily about money. There's financial wisdom, there's financial training, and there's the art of buying and selling. And that is one of the things I like to do. I like to invest in things around cancer medicine, things around property, things around bonds and shares and stuff. And it makes life exciting, you know.
How do you get all of this time if you're a busy physician, an oncologist who is also immersed in reading?
I mean, there's plenty of time for things that anyone is interested in. It's just interest. In the same way that, a busy mom could be looking after two or three children and be sewing, some materials to be sold in the market, and will cook and do all sorts of things at home. It is interest. If one has an interest in something, one will find the time to do it. And I think that's just it.
And I see you also have one of the most important jobs in the world. You are a father.
Mm, mm. Indeed, indeed. I I mean, I do not believe there's anything bigger than raising children, whether biological children or adopted children or children, as a part of a community, schooling and so on and so forth. I do not believe there's a bigger um, responsibility, a bigger calling actually than raising children. And just to see them get born and then to work with them through all those years until they mature into late teenage or adult years, and to have an ongoing respectful and beautiful relationship with them. It's a source of enormous joy, and to pass across values that are, long lasting, and indeed to replicate one's good self, hopefully in them. I don't think that's a bigger calling, and it's a source of great joy.
Well done. Okay. So I was saying before you came on that November is a month that's been dedicated to men, and is a month for men to rediscover themselves, to reinvigorate themselves, rejuvenate themselves, to recalibrate themselves, and get ready for the journey that is ahead. And we're trying to look at man in three different spheres in terms of the body, the mind, and the soul. And a few days ago, we had a very interesting session with a psychiatric colleague, and where we focused on men's mind. Um, and there we discovered that black men can talk too, because this month is not just particularly on this hangout category. It's not just about men, but also with a little bit of emphasis on black men.
Yeah.
So we looked at black men, and we also realized that black men can talk too, but they needed the right environment to be able to express themselves without feeling judged. But we wanted to move away from the mind now to look at the physical body. So what can you tell us about men, their physical bodies, what it is that they are meant to be doing with it, to it, and how to nurture it to get the maximum out of it? So how do we take our bodies from a Volkswagen to a Rolls Royce?
That's a good way of asking that question. Last month or so, I had a live meeting with a group of Igbo men here in Birmingham. I think we were about 46 or something, just talking about this kind of issue. And in that particular one, we talked about diabetes and stuff. But as a whole, you see, black men are very, very busy. All of us trying to run homes, trying to make money, invest for the future, study, and so on and so forth. And there's this massive, massive likelihood that we tend to neglect our physical bodies. Okay, we don't get enough sleep. We don't relax enough. We think that all of the problems of this world that we can carry them. And I think that moving from a battered to a formidable Rolls Royce starts from thinking differently and trying to remember that we've got only one life, just one. And even if there was reincarnation, we are not going to reincarnate in this same form, well, according to those that believe in it. So it's just one life, and to do our best to live it well. Um, Doing our best to live it well is to actually, number one, determine those things that we enjoy doing or not doing, as the case may be. Number two, learning to have regular checkups, especially when we hit the age of 40 and above. So something like blood pressure, so common amongst black men and quite difficult to control, as a whole. It can just creep up on us without knowing, completely symptomless. And lots of black men that go to bed and then don't wake up in the morning. It's simply that blood pressure was so high and it caused some kind of abnormal heart rhythm and they died from there. So to think differently, to go for regular, at least yearly checkups, check our eye pressure, blood sugar, prostate thingy, height and weight. Number three, to eat well. Now, eating well is not, well, our people eat a lot. And eating a lot is not the same thing as eating well.
Hmm.
Yeah. So, I mean, if you see a typical black man eating eba, yeah, I mean, the volume of food, the amount of food can be really shocking. So eating well is a combination of the kinds of food and for me, more importantly, the the quantity of food. Okay. And finding time also, number four, finding time also to go out, weekends, meet up with friends, meet up with colleagues, get to the pub. Yes, go watch football in a viewing center and so on and so forth to find enjoyment in life. I think that we should begin to learn that we are number one before any other person. Not in a selfish way, but in a self-catering way. And I think that all these factors can help.
So it's interesting that you've one of the things you've said there, that the input determines the output. So what you put in one way or the other determines what we get from our body. So rubbish in, rubbish out.
Indeed, indeed, um, indeed. And there's really no other way of putting it. And we should obtain knowledge, you know, and to compare ourselves less with each other and with all sorts of people, and to learn to be content with our station in life at any particular point. At times, people think that contentment is complacency. It's not at all. But being glad and happy with how far we've come while making strides to to go higher, to do better. Peace of mind. Very important.
So if we look at men, and if we look at black men particularly, I know you've talked about high blood pressure. So what are the other things that maybe ailments that may affect men particularly, but more so black men in particular?
Mm. Yeah, I mean, both of us are cancer physicians, and things like something like prostate cancer can only occur in men. Women don't have prostate cancer, alas, thankfully. They, they have enough already. So men do have prostate cancer, and this is quite common in black men. In fact, uh, men in general, almost every man will end up with prostate cancer if they live long enough. If you do a
Hmm.
postmortem, yeah, if you do a postmortem of men, into 80s and stuff, you almost always see prostate cancer in their prostate. It's just that it did not come to clinical manifestation.
Mhm.
So that is really, really common. And it is not just that it is common in black men, it is also more resistant to intervention in black men. And more so for the black men that live in black Africa, where facilities and the cost of appropriate treatment can be really, really high. Okay. Now, the other thing is also about the testicles. Women don't have testicles. Again, thankfully. Well, not yet. Um, I tell you. So, and yes, men can be affected by testicular cancer and, you know, other conditions that might affect testicle, and also issues around erection and sexual function, erectile dysfunction, premature ejaculation, and issues around sexual health. You know, these are particular things that only men can face, and very, very common also in black men. And uh, in particular, while I was talking to this group of black men here, so lots of us are foreigners in a foreign land, immigrants in a foreign land. Aside from all the physical things that affect us, we are also combating all sorts of emotional issues around
Mm.
immigration, issues around feeling a part of society, you know, issues around the sense of personal self-worth, in a foreign land when compared to where we came from in Nigeria, and Africa as a whole. And all of these things affect our physical bodily functions. And there are also things to look into. Um, so aside from all of those about the prostate and the testicles and the penis, I mean, yes, something like blood pressure. Yes, women also have blood pressure, but black men in particular have a particularly hard time having it under control. Uh, Diabetes mellitus and so on and so forth. Yeah. Yeah.
So
So
I'm going to try and break it down into two different categories: cancer and not cancer and non-cancer diseases. One, in terms of the cancer aspect, I know you've mentioned prostate cancer and testicular cancer, which are solely domain of men. In what age groups are these cancers common, and how should we be looking out for them?
yeah, testicular cancers are generally commoner in young males or younger males, 20s, 30s. As we age, they're not as common. And usually people just feel a lump in the testicle. And then that usually is what draws attention to it. And there are different kinds of testicular cancers. But by and large, the seminomas, which are generally common, are quite easy to treat. Surgical excision, and then depending on what you see in the pathology, you can then either offer radiotherapy or offer chemotherapy, just one shot. And then there's a very, very high chance of cure. In fact, it is one of the cancers that people have that we can comfortably achieve a cure. Okay, and then there are the teratomas, which are a bit more difficult to manage, but there are other ways of treating them too. And with with the prostate, most times there aren't any particular symptoms. Of course, people can have issues with urination, burning, not being able to have a full stream while weighing, or feeling as if all of the whey is yet to be evacuated after weighing, and so on and so forth. But by far, in most cases, it is completely asymptomatic. When prostate cancer becomes symptomatic, usually it is because it is already advanced. A few years ago, an uncle of mine at Enugu just, called me complaining of body aches, just aching all over, you know, that no amount of paracetamol or treating typhoid and malaria has um, helped. And at that time, he was in his early 60s and just managed to see a doctor who was thinking, who checked his PSA, the prostate, prostate specific antigen. And lo and behold, it was sky high. And they did a scan, and it turned out he had prostate cancer that had spread to literally all of his bones. And that was what was causing him the pains that he was having. But you see, I mean, it was extremely late then, even though there's still treatment, though not curable, but treatable. Nevertheless, very late. And this is why we say from the age of 40 at least, people should have their PSA tested yearly at least. There are normal levels and abnormal levels. And depending on what is found, then interventions can start.
So I see you've mentioned two different extremes with cancer. Testicular cancer in the younger people that is relatively treatable, and in some instances we can achieve a cure. And for a lot of people, they may remember Lance Armstrong, who had testicular cancer and was cured from it. And you've also talked about the other extreme, which are older men that do get prostate cancer. And yes, you're also saying that that can be treated, and in some instances, it can be cured, particularly if it's picked up early. So this PSA test, how can one obtain it? Are you offered it regularly? Do you have to demand it? And then where is it available? Is it readily available both in the Western countries and also back home in terms of countries of origin?
So in England here, um, oh, well, me, I use myself as an example. I'm a typical black man. I refused to do any test up until mid 40s or something. And it was for something completely different. I just take PSA and so on and so forth. And thankfully, everything came back normal. And since then, I've been having it done yearly. I think that in England, there's a well, in my GP service, from the age of 45 or something, if I remember clearly now, you get a text or a letter to come in and have a full bodily check. And that also includes the PSA. And it's a yearly thing. I'm not sure that service exists in Nigeria. Uh, it might be that with this health insurance thing happening and general practice service becoming more streamlined, that it might be that in some areas it is beginning to happen, but I think that most people will need to ask a doctor to do that test for them. And because of that, therefore, and with people far more concerned about what they should eat, or what they can afford to eat or not eat, you know, asking for a PSA test just out of the blues, it's not something that happens often in our country. And so I think that this is where education comes in, that we mustn't wait until we begin to see some symptoms before going to see a physician. That seeing a doctor on a regular basis should be a routine, something we do routinely, at least yearly. Okay, and yeah.
And I see that in the last few years, a lot of diasporans have gone back home to their own countries of origin. But one of the things that seems to happen is that you have the haves and the have-nots. But in terms of catering for the have-nots, you then find that the people that are trying to cater for them sometimes go over the top. So how do you manage that? So somebody tells you to come for a full body screening. So they do MRI of your head, MRI of your body, CT scan of your toenails and everything, and all known blood tests to man. So how do you cut it as to what should be done, what shouldn't be done, when should we ask for it?
Well, they say these are the challenges of a place like Nigeria, where people are just out there to make as much money as they can. Um, how do we? I think our people should learn to call up and seek advice. Okay. Um, we got family members all over the place, and many of them are nurses and doctors and stuff. And if we don't have, we've got friends who have um, member well, who are either medical practitioners or know people who are medical practitioners. I think we should call up first and ask, seek advice. Say, listen, this is what I'm thinking about. What are the tests that I should do, and where is the best place to get them at the most cost-effective price? I think also that a lot of this responsibility might actually lie on the women. the mothers, the wives, the girlfriends, the sisters, nieces, and stuff. Women generally are far more attuned or tuned into looking after themselves health wise. And I think that a lot of our men might actually need their help in getting them to do these things and seeking the best possible ways to get them done. Those two ways I think might help. But Nigeria, especially, is an extremely fascinating place in all sorts of ways, both positive and negative. And I think that we are very, very um, impressed with shiny new machines. I mean, seeing an MRI scan and all the noise and the CT, there's a tendency to just like, okay, fine, let's go do it, and see what it shows. But most time it is completely unnecessary and expensive. Yeah.
So it's interesting some of the things that you've said there, but isn't it a lot to be asking our women to do? Some of them are daughters and they have to cater for the fathers. Some of them are mothers and they have to look after their children. And the poor wife that is in the middle that has to look after husband, children, parents, and so it's a lot. And then you have to add in sisters as well. I hope we would not overwork these helpmates that have been designed to try and help and support us. But the other thing I just wanted to also focus on, because I know we've talked about two extremes, young men and older men. What about the in between? What are the things that we need to watch out for? And I know there you said you also treat breast cancer. Is it possible for a man to have breast cancer?
Yeah. So in between the extreme, like I tried to allude, from the age of 40 thereabouts, people should develop the culture of going to see a healthcare provider in a reputable place to do a general physical examination and at least some basic blood tests. Number two, people should watch what they eat, how they eat it, and much more importantly, the quantity of food they take. And in that way, look for ways to keep their weight within normal limits. And I'm also trying to work very hard towards that. And also to keep themselves exercise. And yes, men do have breast cancer. I have about 4 men in my book at the moment that are undergoing treatment for metastatic, breast cancer that has spread. So even though in the vast majority it occurs in women, there are men also that have breast cancer, and their treatment is essentially as it is with women. So we are not exempt. And this is also a part of this thing about a physical examination, for a clinician to just thoroughly, do a top to bottom assessment and make sure things are okay at least once a year. I think that in our middle years, if we have this as a culture, much more often than not, when things are early, well, things can be caught when they're early. At quick point, treatments and interventions are far more effective, and the chance of achieving cures are far more likely. Um, this should be a culture. And yes, you talked about the women in our lives. The responsibility that women have is massive, is huge. Women run homes, and men are a part of the homes that they run. So I'm afraid they have a responsibility also to the men in their homes. It is not easy to be a woman, especially in our African setting. It's a lot of responsibility, and I know that that's a way a woman, a wife, sister, daughter, will talk to their man or to the male, and instead of seeing a reciprocal action, they actually see the opposite. And so it's even more pressure on them to know how to pass across a message to the man in the house to get them to do what they're supposed to do. But yes, it is a lot of responsibility, and I'm afraid it is also in their best interest to make sure that their men are alive and well.
So I'll
Mhm.
try and move away from cancer into physical ailments now. So I'm just to talk about the middle. Um, we know that women, when they get to the middle ages, they just suffer with menopause. Do men suffer with a male equivalent? And I know you've also mentioned erectile dysfunction. And is that related to the male equivalent of menopause?
Well, there's um, something they call the andropause, or
Okay.
I prefer to call the middle life crisis. Um, Personally, I don't think that it is primarily uh, a change in hormonal profile that happens to men. I think it's just that a time reaches when a man inadvertently sits himself down and just asks himself how far he's come relative to where he thought he should be by that time, 45, 50, and then seeing old age coming and retirement and mortality. I think that the sum total or the balance between expectation and the reality many times is what makes men begin to behave either differently or erratically. Um, and yes, it is extremely common. Uh, just irritability, spending money in utterly foolish ways, not listening to people, can't take advice, you know, looking for side chicks and second wives, and so on and so forth. Um, so yes, it does happen to men, and I think also that again, here is a part of the responsibility that our women uh, will need to take upon themselves to understand that in the same way we understand or we try to understand their menopause, uh, to understand that uh, for men, especially black men, uh, there is a lot of emphasis they place on achievement, physical achievement. I'm 50 years old. Have I built a house? Are my children at uni? I even married. I have a car, and so on and so forth. They have respect amongst my colleagues and my community. Am I at the peak of a career, or am I getting there? What are my prospects in the next 5, 10 years? What am I going to do when I retire? And so on and so forth. And from the age of 40 upwards, lots and lots of men begin to think this way. And yes, if things are not going the way they think that they ought to, especially when they compare themselves with other people, it can make them to begin to behave erratic. And yeah, that again, I think is a part of the challenge that men face.
So now there you talk about comparing themselves with other people. Does that have a role to play in terms of how men suffer and deal with erectile dysfunction, which I think is something that tends to happen around that more middle age territory? So is there a little bit of competition going there? People thinking I should be the same person I was when I was younger, but then they are not the same kind of person, and people start to look for esoteric means to try to be who they think they ought to be.
Yeah, yeah. Is it not the nature of a man to be competitive, to strive, to do more? I think in the vast majority of men, especially Nigerian men, there's this innate desire to be in charge, to 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 be the one calling the shots, especially in the family and especially money wise. Um, and when for one reason or the other, and I suspect this is part of the reason why there's so much family disintegration when people migrate, from West Africa to Europe or to North America, especially. There's a massive equalization between men and women. Massive. Everybody is literally earning the same thing. And so there's a tendency for our men to think or to become emasculated, to not be able to adjust to the fact that what they have or don't have, as far as money is concerned, ought not to be the source of their personal confidence, ought not to be the primary reason why they look at themselves the way they look at themselves. A bit difficult to explain, but this is something that is extremely common in our culture, especially with the Igbo culture. I mean, what a man has or does not have utterly defines him. And for me, this is completely unfortunate. And so that, well, menopause or andropause, is feeds into this narrative. There's a tendency to feel small, to feel little when we don't have as we think that we ought to. There's a tendency to compare ourselves with other men. After all, we went to the same school, graduated the same year, was even better in school. Like I said before, as if school was a determinant of continuing financial success. There's a tendency to think too much, if you ask me, about who we ought to be at a certain level, and at this it can be a problem. Yeah.
So now we focused a little bit on cancer, but we also wanted us to focus a little bit on the other aspects of physical health. So putting cancer aside, and I know you've mentioned a little bit about diabetes, what are the other common diseases that we need to be aware of, particularly in black men, that may be easily prevented, but if not prevented, can be treated? We know many of these diseases are lifelong diseases when people do develop them, and then it has to be managed. So, what are some of those things that we men, particularly black men, ought to be watching out for, and how do we do it? So, do you have any specific diseases that we need to be focusing on? Things like diabetes,
Yeah.
things like kidney diseases, things like nervous diseases, things like stroke. And
Yeah.
then when men get older, we don't have to deal with the issue of dementia as well. So, what are the salient points we need to know about some of these diseases?
I think that possibly the most formidable underlying physical condition, underneath all these things is high blood pressure. In fact, if you look at the non-communicable disease group, there's high blood pressure, there's hyperlipidemia, there's type 2 diabetes mellitus, and there's atherosclerosis. High blood pressure appears to be the unifying factor, you know, amongst all these, and appears to also be the underlying factor, you know, behind the stroke and kidney disease and so on and so forth that you mentioned. High blood pressure is extremely common in black men, and it's very, very silent. I was shocked earlier this year to realize that my blood pressure was high. Okezie Ofor. I was shocked. After that, gosh, I've been utterly well. I'm not on any medication, nothing whatsoever. Feel good and so on and so forth. Not even I went to do an insurance policy, and they insisted that I should do a treadmill. This exercise ECG treadmill assessment. Halfway through it, they stopped the assessment because my blood pressure was just through the roof. They were staring at me. I was staring at them, and they were like, "Are you hypertensive?" I said, "I have no idea. I've never checked." And since then, thankfully, everything is back to normal. I've not had to be on any tablets for a while now, but it's just so classical. High blood pressure is extremely common amongst black men, and this is something that I will say and keep saying that every black man should have a blood pressure kit at home and to check their blood pressure at least twice a week. After you come back from work, late in the evening, sit down, take a measurement, wait another 5 minutes, repeat it, and then another extra 5 minutes, meaning at the blood pressure at the 10-minute mark is the actual blood pressure, and then keep a record. It's very, very important. The way blood pressure affects us is quite different from the way it affects white people. In the white, it primarily attacks their heart, and they end up with um, myocardial infarction and so on and so forth. For the black man, it is primarily the kidney and the brain. So kidney failure and stroke that it attacks. In fact, when it comes to the heart, it is not often actually, unless there's concomitant heart failure. It is not often that our blood, especially early on, that the blood pressure affects our heart, aside from causing an abnormal rhythm, an abnormality in the electrical activity of the heart. And that many times is not easy to detect unless you begin to have symptoms. So yes, I do not believe it is possible to emphasize this thing about blood pressure enough. And anywhere I go to speak, especially if there's a black person there, and if there are black males, I say, buy a blood pressure monitor, put at home, check your blood pressure on a regular basis. And if we're able to bring blood pressure under control, I think that a significant number of all these other non-communicable diseases, obesity, and so on and so forth, will be much easier to handle. Yeah.
So, it was Black Friday yesterday, and there were lots of sales going on. So should it be that all of the women should look at the men in their lives, their fathers, their husbands, their brothers, and their sons, if they're old enough, if you don't have a blood pressure machine, to buy them one for Christmas?
Very important. Very, very important. That it should be a standard Christmas gift, to all men. In fact, I have 3 in my house.
And the other thing that I found interesting in what you said there was the way high blood pressure affects black men and white men differently. So, do you mind going over that again?
Yeah. So you see the thing about blood pressure in the black, yeah? I mean, lots and lots of studies, around blood pressure in the blacks. The heat and the extreme sunshine uh, in Africa as a whole, yeah, it's actually an environmental adaptation that allows us to lose salt in sweat. And without salt loss, there's a natural way or an additional natural way that um, the universe or God has given us to keep our blood pressures under control. So when we come over to the Western world, even if there's sun, we don't sweat. Okay, and if anything, it's even colder than ever. So that way that we manage to lose salt that helps us control our blood pressures more is automatically gone. And that's a part of why you see here the blood pressure management in the white person is quite different from how it can be managed in the black person. Our our blood pressures are far more refractory to treat than that of the white. And yes, target organ damage or end organ damage associated with blood pressure is quite different in the black compared to the white. And this is a part of a study I began to do before I left Abakaliki many years ago and came to England. I was trying to look at the difference between the control of blood pressure in our people, in men who work in open space, in markets in Abakaliki, compared to men who work in air-conditioned offices like banks and so on and so forth, to see if that environmental difference, in the exposure to ambient temperatures, actually indeed still has an effect on blood pressure phenotype and treatment paradigms. Unfortunately, I couldn't finish it before I left. But even before I left, I mean, as we all know, especially old textbooks, we need to sweat. Okay, and that's why a part of the whole thing about controlling blood pressure is also about exercise and go out to play football, jog, go to the gym, sweat. It is important for the African man to sweat. Okay? And yes, it is different in the blacks compared to the whites. Definitely, as with most diseases, actually.
So from what I can gather there, that a black man is biologically and evolutionarily different from a white man, and therefore we are likely to suffer different diseases, or present with the same disease in different ways with different effects.
Yeah, absolutely.
Aside, aside from blood pressure, what about other things like diabetes? Because we seem to see that a lot of black men, when they do suffer diabetes, they don't control it very well and
Mm.
they end up with kidney damage. So, if we look at diabetes as a very common condition, that's particularly common in black men as well. What more should we be watching out for, and how is it different from a black man and a white man?
Uh, Diabetes again, as with blood pressure, is to catch it early. You know, even from the level of insulin resistance, as in, let's watch our weights, and I am also talking to myself about that. Let's watch our weights because we we get to a certain size, and our cells become resistant to the action of insulin, as in that insulin finds it more difficult to push sugar in and out as it gets maybe of the cell. Well, in this time around. And so if we're able to watch our weights and watch how much food we eat, that will help. Now, yes, diabetes mellitus does affect every organ in the body. Remember also that the link between diabetes and high blood pressure is almost literally non-existent. In fact, there are all sorts of hypotheses that high blood pressure can actually transform into type 2 diabetes mellitus. I mean, there are all sorts of endocrinology hypotheses to support that. And I think that okay, I'll give you an example. Okay, I did my part two thesis here on diabetic cardiomyopathy, meaning how type 2 diabetes affects the heart in black men. So I got 50 patients and then compared them to another 50 patients who did not have diabetes. And I looked at these people with established type 2 diabetes without any blood pressure, no kidney dysfunction, no nothing, just the pure form of abnormal blood sugar control and the associated vascular and lipid abnormality. How does it affect the black man's heart? Now, comparing it with black people that didn't have any diabetes, there was no difference whatsoever. However, the white person with type 2 diabetes without any blood pressure, none of the associated factors, one of the major things that they end up having is angina, cardiac dysfunction. So it differs between us and the whites.
Yeah. So, Doctor, for if I may just ask, some of these medical things that you are saying, all of us don't understand it. You are saying angina. So, what is
And,
angina? So,
okay,
yes,
so
you are speaking to mere mortals, not medical. So, if we can just take away the medical things so that people can understand. Yes.
okay, so angina is where there's a block in the blood supply to the heart. And so if you try to do some exercise, because there isn't the usual amount of blood flowing to the heart muscle, it causes pain. So people have chest pain when they want to do some activities. I mean that's the English word angina. Okay,
Okay.
and yeah, and there are many ways. So diabetes can cause those blood vessels to become thick. When they are thick, they don't allow enough blood to supply the heart muscle itself.
Mm.
And so people try to do some activity and they get chest pain. Right? So like I was saying, it is not that common in the black man. But then what happens is that it is the kidneys. There's this um, predilection. There's this tendency for the kidneys and the brain to be particularly affected in black people, unlike the heart. Okay, just common for the white person. And there are also all sorts of hypotheses that have been used to try to explain this, but yeah, it's a fact. So we need to sweat. We need to eat less salt. We need to control our blood pressures. We need to check our blood sugars, uh, cholesterol levels on a regular basis. This will help.
So just as you're talking about the sweat issue, is it the same way it affects men that it affects women as well?
I suspect so. I suspect so. Somehow, though, it turns out maybe because of late presentation and men just generally being more careless with their health. We see, you see, women, um, maybe because of pregnancy and things around fertility, appear to begin to seek out medical intervention much earlier in life. And so, if they're going to be hypertensive, it will be caught earlier. And because it is caught earlier, things appear to be better controlled on the long run compared to men. For our men, it's almost always late, and control is not as good. And when this kind of, when these conditions are already established, it can be quite difficult and expensive to do much about them. And I suspect it is the same in women, but somehow or the other, the outcomes are generally worse in our men.
So it seems like black men are particularly disadvantaged. One, when you look at the human species, the fact that we are men compared to women, we're already at a disadvantage. And then when you're a black man, there's an added disadvantage. Am I hearing that correctly?
Uh, I'm not sure whether to call it a disadvantage or for us to be more careful with ourselves, to be more kind to ourselves, to look inwards a bit more, to be more selfish with ourselves. We do so much, we carry so much load, so much weight, so much responsibility. We look after everybody except ourselves. And I think it is time for our men, black men, to begin to reverse that order and to understand that there's nothing we can. Okay, it says, love God and love your neighbor as much as you love yourself. You can only love anybody or God only as much as you love yourself. And this is one admonition that all of us must learn.
Thank you. I know. Thank you very much for your time. I know I've taken up a lot of your time, but just as we start to round up, so I'm hearing that diseases are common in men. Certain diseases are more common in men than in women. Men in the younger age group, testicular cancer is a common disease, and in the older age group, prostate cancer is also common. There are also other cancers that they can develop in between. Men can also have breast cancer. So yes, breast cancer is not an exclusive preserve of women, and it tends to present later in men. But separately, when it comes to non-cancer diseases, it seems like from what I'm hearing from you, hypertension seems to be the major thing because it seems to be the precursor and the forerunner for everything and makes everything worse. So your hypertension can make your diabetes worse. Your hypertension can make your heart diseases worse. Your hypertension can make brain diseases worse. And
Yeah,
also because we're black men, because we've been exposed to the sun, it affects the way our kidneys function, so we've not sweated as much as we ought to, and therefore that can play its role as well. And I also hear you talk about the fact that what we eat can make a difference. So rubbish in, rubbish out.
mm,
That's the way it is. But I also hear you say that it's important that we should know some of our own numbers.
yep,
Numbers like your blood pressure, numbers like your blood sugar level, numbers like your cholesterol. I also hear that we should have our own checks quite regularly as well. So we should try to book it a year. And I think sometimes what I say to people is if you drive a car, when you book your car's MOT, book your own MOT as well. And that
yep.
could serve as a timely reminder. but also the way that women have to examine their breast regularly. Perhaps men should also examine their testicles regularly as well, so
Yep.
that they know their knots and they know how it feels, and they know when it is they know when it is abnormal, and that when you do have symptoms, there is no shame in going to ask for your symptoms to be evaluated. It is
Mm,
better to be safe than
that's
sorry.
right.
Prevention is much better than cure. But I don't know if you have anything more to add just to a little bit of that summary as we try to round up.
Yeah, that's a fantastic summary. And yes, just one thing, like I said before, that men must learn to love themselves more. Very, very important. The loving ourselves more, many times for the black man, is associated with guilt, and
Hmm.
it ought not to be. Okay, we need to be alive and well to be able to look after our families, and this is really important.
And then as we start to round up, men will get older. What is the is there anything that's been done with respect to dementia in black men particularly? Yes, it's something that we're seeing more commonly in older people here in diaspora, but what about men? How does it relate to men? Because we didn't used to live till that long. A lot of men will have been taken
Yeah,
care of by diabetes, hypertension, malaria. But now that they're living longer, what about dementia in older men?
yeah, exactly. Like you say, that is. I mean, it is just the fact that we're living longer. A significant number of people will get some degree of dementia with age. I think that it is heightened in the presence of diabetes and high blood pressure and cholesterol and so on and so forth, because these conditions also damage cells in the brain, and um, and so what we can do is to live as well as possible, is to have regular checks when any of these conditions develop, to treat them and control them as vigorously as possible, and also to find things that we enjoy doing. Some uh, people that we enjoy hanging out with, hobbies that we like doing, and to stimulate our minds. I talked about reading at the beginning. Reading is crucial. You know, to stimulate our minds and to be happy. You know.
Thank you very much,
Mhm.
Doctor, for I think on behalf of my fellow baristas, I just want to say thank you very much for giving up your precious time on a Saturday afternoon. And I think it's been very enlightening and illuminating, particularly the issue of blood pressure, which is the number one thing that we have to focus on and we have to manage. So I just want to say a very, very big thank you to you.
You're welcome. You're welcome. Thank you for inviting me. It's been a fantastic time. Thank you.
Thank you, Mark. Thank you very much. So, fellow baristas, you've heard it there. Men, women, blood pressure is quite important. It's important that we keep it under control. For your men, if you don't have a blood pressure machine at home, that's a very, very good Christmas present for your brothers, for your sons, for your fathers, for your husbands, for your boyfriends. Get a blood pressure machine for them. We should also know our numbers, know your blood pressure. So you should be able to go out there. People say, what's happening? What's your blood pressure? We should be one of the people that will raise up our hands and say, I know what my blood pressure is. Know your cholesterol numbers, particularly. Know your blood sugar, and then check your knots regularly as well. We do not want to be caught. We do not want to be caught out. So have a fantastic and blessed Saturday. Thank you.